Infertility, or otherwise we can call it subfertility, is a condition where a woman fails to conceive after 1 year of regular sexual intercourse. Okay. What happens in this case is woman tends to wait for the second year or even wait for the third year. Okay. I'm here to enlighten us all that waiting does not normally produce the results. Okay. So after a year of subfertility, we normally encourage the woman to come and seek treatment. Normally, after a year of not conceiving, we would encourage the couple to come and for consultation, both the husband and the wife. We can start off investigations with the husband by doing a simple sperm test, and the wife by doing a blood test and ultrasound. Following the test, we will roughly know where do we stand, whether the cause of subfertility is from the hormonal point of view, or is it from the fallopian tubes, or is it from the abnormal sperm count of the husband. And having determined the cause, normally we will go towards the treatment. Treatment for subfertility, normally we start from taking tablets. Tablets will help for ovulation induction. Okay, because at most of the time, 70% of the time, fertility problems arise from anovulation. Right? So tablets that we use, clomiphene citrate, you could start at 1 tablet daily for 5 days, and then leading on to 2 tablets daily for 5 days, or 3 tablets daily for 5 days. Okay. We will try tablet medication for 2 to 3 months, and if it does not work, okay, we will go on to IUI. IUI is a procedure where we will stimulate the woman using injections, tablet, and following that, when we achieve the correct egg size, we will have the husband's sperm produced, and we will do artificial insemination. Okay, IUI stands for intrauterine insemination. Right. During this procedure, the husband's sperm is taken at early in the morning at 8 a.m. It is pre-washed. Okay, and after 3 hours, it is introduced by a syringe into the vagina. Okay, no sexual intercourse is required for this procedure. However, IUI has its limits. Okay. The success rate for IUI is rather low. It's about 20 to 22%. Okay, and so couples has to be selected for this procedure. Not everyone can go through IUI. If after 2 or 3 cycles of IUI and nothing happens, okay, we will go a step higher. A step higher would be introducing in vitro fertilization, what we call IVF, okay, in vitro fertilization. During this process, the woman will be stimulated using injections for 10 to 12 days, during which time the eggs will grow. It will grow to a certain size between 18 to 20 mm. When we have achieved the correct size, we will give one injection to trigger. The word is trigger, and at 36 hours after trigger, we will do one procedure called OPU, ovum pickup. Ovum pickup is done under sedation, where the woman comes in the morning, and the procedure is actually to harvest the egg. So our aim is to harvest as many eggs as possible. On average, a woman can produce between 12 to 15 eggs per cycle. If the stimulation is done very well, we can achieve between 15 to 18 eggs, and sometimes above 20 eggs. So after harvesting, what happens? After harvesting, it will be 3 days later, the women need to wait, and we will go on to embryo transfer. Okay. Embryo transfer can be done at the 3rd day, can be done at the 5th day, sometimes the 6th day. Okay. What happens during embryo transfer? The the embryo of day 3 embryo will be introduced back into the vagina, into the uterus, okay, by an experienced fertility specialist. Right. And having introduced that is when the IVF procedure stops. Okay. And thereafter, the woman needs to take the much needed bed rest for the next 2 weeks and wait for the good results. In summary, I would like to say that IVF is now a very common procedure that can be done in many centers, okay, and it's not a really difficult procedure, right? We are achieving better and better results with IVF procedures. So we encourage women who have problems with fertility to come forward and get yourself examined, checked, and we can identify the problem, we can help you, and we can turn the hope into reality.